Hi, I'm Christine. I've been an advanced lung cancer survivor for 8 years. Today, I will talk about my lung cancer diagnosis and treatment. My cancer journey has two periods. One is to fight against cancer from 2015 to 2018, and another one is to live with cancer after 2018. I also experienced two types of health crises related to cancer. They are physical health and mental health. Today, I will talk about physical health. This is one of the hospitals that treat cancer in my city. In early 2015, I noticed my handwriting was getting smaller toward the end of sentences. Also, I had difficulties using chopsticks to eat. As a Chinese, using chopsticks was my thing. I thought something was going wrong with my brain. So I had an MRI, and on the second day of my MRI scan, my doctor called and asked me to go to the emergency room immediately, saying they found a tumor in my brain. Likely it was cancer. I went to the emergency room, and the emergency doctor did many tests like blood tests and CT scans. Several hours later, I was told that I had lung cancer metastatic to the brain. After 3 days in the emergency room, I was transferred to a special floor where the nurse told me all the patients there were terminal. My heart skipped several beats. Later, I found out that the floor was a hospice. I stayed in the hospice for another 12 days. These 12 days have fundamentally changed me. I was no longer in control of my life, and I lost dignity. Then, I found a young oncologist, Dr. Dao. This doctor has been responsible for my survival for 8 years, and I'm forever in debt to him. Here is why. In the first visit, Dr. Dao told me and my husband that there was a biomarker testing to see if I had specific mutations. If yes, it was possible to use targeted therapy drug. But Dr. Dao had to send a biopsy to the States and wait for 1.5 months. Of course, it's not covered by health insurance, and we had to pay 5,000 US dollar at a time. Keeping in mind, biomarker testing was not often done in Canada 8 years ago. To make a long story short, I did the biomarker testing. Meanwhile, I started chemotherapy, but it only worked for a short period. But my biomarker testing results returned, and I had ROS1 positive lung cancer. ROS1 positive is a genetic mutation, and only 1 to 2% of lung cancer patients have ROS1 positive mutation. Luckily, the first-line targeted therapy at the time was available, and it is a pill called quizartinib. So I started the medication, and now I'm in my 8th year, and my cancer is still under control. It appears to be a simple story, but it took 3 years for me to stabilize the cancer. The complication of cancer and the side effect of chemo and targeted therapy were not trivial. Firstly, the brain tumor are at my language and motion control center, so I couldn't talk properly as I stuttered and forgot words and sentences. Something I learned is called brocathaphasia. Also, the brain tumor severely weakened the right side of my body. because of practicing and exercising, I can manage to talk and walk today. Secondly, I got severe chemo brain due to chemotherapy. Together with a brain tumor at the language center, talking was the main challenge till now. Thirdly, crizotinib didn't collaborate with me initially as my platinum was dangerously low and my liver reading was dangerously high. So it took me a while to adjust the dose of the drug. In 2018, I turned entirely blind for 4 months due to the steroid caused severe cataracts in my both eyes. In the summer of 2018, I was at my lowest point. I was desperate and hopeless. I was like a person in a deep sleep mood and in a horrible nightmare. How did I wake up? I will talk about the mental health issue and how I wake up from the nightmare next time. Okay, today we stop here. I'm Christine. Till next time, see you then.